Hi, it's Dr. Meyer coming to you from San Francisco, and I wanted to introduce you to one of my new patients, Stephanie. She has been coming in only for a few weeks, and I asked if she wouldn't mind telling her story a little bit so that people who are considering chiropractic care or our office might have an idea of what some other people experience. So, first of all, thank you for your willingness to do this. So, can you just tell us what was going on that you decided you needed to come in and see us?
So I fell and started getting these really bad pain in my hip and in my back and my shoulders and my neck. And at first I thought, well, I'm young, it'll get better. But after a few weeks, it was getting worse and worse. And I was like, I'm too young to have this sort of problem. I have to figure out what's going on. And originally I went to a physical therapist and they weren't really able to help me. And then a friend sent me here and you started helping me with my problem. You did x-rays and did a really thorough job looking at what was going on with me and started treatment immediately.
And had you been to a chiropractor ever before?
I'd only been to one time, and it was because I was home and it was right before I came here and this injury just got really aggravated and I needed to see someone. And so I went in one time, I was like, okay, I didn't really know much about it. And then when I got back here, my friend recommended you, I came in and wasn't really sure what to expect because I hadn't really had a lot of chiropractic treatment in the past, and was very happy with what's happened and what you've done for me.
Terrific, thank you. What was your impression of what chiropractic was for?
I thought it was like getting a massage, actually. I didn't really know much about it. I definitely didn't think there was so much of the medical side in it, and I really thought it'd be like going to get a massage.
Okay. So you came in and you had this injury, and we did an exam, and we started doing some treatment, providing some chiropractic care, and we did some therapies, right? We've been using some muscle stimulation.
Yeah.
That feels good.
Yeah,
Yeah, it's really nice and relaxing, helps to loosen things up, helps to lower the pain. You were taking a fair amount of medication. Would you say a fair amount or like, no, hardly any?
A fair amount, and I'm a student, it was, makes you tired. I couldn't keep taking that every day, and it was great because you wanted to get me off the medication too and find a way to heal myself and not be dependent on things like that, because you can't be taking a pill every day. That's a temporary fix. And I feel like I got off it pretty quickly with you, and you encouraged me to keep coming back, fighting through it, and working to make myself better. And now I rarely, if ever, take any of the pills, and the pain has gone away so much.
Cool. So, just to touch on the medication, the reason that I wanted you off of that, obviously is not because I wanted you suffering and, you can just deal with the pain, right? That was not what it was about, right? No. It was about, we're just trying to make you a healthier individual.
Yeah.
And as we're trying to heal from the injuries, we want to try and address everything at the same time without creating burdens, right?
Yeah.
Okay, so great. So we got the pain to diminish, and medication has, been able to be basically weaned off. Now it's, infrequent that you would have to take it. We talked about some other things too, right? We talked about fitness and exercise, what's okay during this process while you're healing, and also maybe some kind of expectation about what we want you to be doing down the road so that we can optimize your health.
Yeah, absolutely.
And we also talked a little bit about nutrition, right? And I'm not looking to get into specifics, but if we're going to have, the greatest degree of wellness and the best health we can, then we have to have an understanding and apply certain principles when it comes to what we eat, as well as how we exercise and getting adjusted and rest and all that, right?
Yeah, it was very well rounded, what you told me. It wasn't just come in, let me work on these problem areas, let me stretch you out so you'll feel better, and go home. It was like, well, that's just one aspect of the many things that contribute to your problem, and let's address all the different things that come into play and see if we can work on all of them so they come together and you get better quicker and learn better methods to deal with this in the future and continue to improve.
Beautiful. So at the risk of sounding redundant, if you could just say something. I didn't tell you ahead of time I was going to ask you to do this, but if you could tell anybody watching this, would you recommend our services? Do you feel like it should only be someone who's injured, or is our service applicable for people who just want to optimize their health?
Yeah.
What would you tell somebody if they were watching this and they just happen to come across it? What would you say to them?
I would say, I think that, sometimes people have misconceptions and just don't know what chiropractic care is, which is, I didn't either. And I came in here and I was so blown away by the degree of help that you've given me in, really integrating all these different methods into my getting better and working with you. Like, you and your staff have been so accommodating, finding ways to fit me in whenever. You've called me to check in on me. And I just feel like I've been so well taken care of. And it's the type of thing where the first time I came in and we did the x-rays, you also had me watch a video. So I was being educated on what was actually going on in my body rather than just like, okay, lay down on the table and we'll fix you. So you gave me a really good understanding of what was going on, which helped me contribute to the process as well and decide, oh, well, now I'm feeling okay, so I'm not going to keep going. I don't need this anymore. I was like, well, this is really a tool that I can use for the rest of my life to continue keeping in good health and practicing, making sure that I'm doing the things that will keep me well balanced and not
You want to feel good when you're older.
Yeah.
You want to have a good quality of life when you're older.
Exactly. And I feel like just going to the doctor and getting adjusted doesn't really do that, but the many aspects that you've dealt with me have been so helpful. And it's the type of thing where now it's not just like, oh, well, I'm not really in pain, so I'm not going to go. It's like, well, I know I don't need to go as often anymore, but this is something I can do to optimize my health for the rest of my life because it has had such a dramatic impact on me and helped me so much in getting better and just making my life better.
Fantastic.
I really appreciate everything you've done, sincerely.
You're welcome. Thank you. Thank you for being a patient. Thank you for your trust. Thank you for helping us out with the video. And if we can help you out, don't hesitate to call. We're at Body Focus and our number is 415-956-3226. Thank you again.
Thank you.